If you're a baseball player, a parent, or coach dealing with nagging shoulder pain, this one's for you. Today, we're diving into one of the most misunderstood injuries in baseball, subacromial shoulder pain.
Welcome back to the Mound Ready podcast, the show where baseball players, parents, and coaches learn how to protect their arms, build real strength, and get back to dominating on the field. I'm your host, Dr. Dominic Rangel. Let's jump into today's episode and get you one step closer to being Mound Ready.
What's going on, everybody? I'm Dominic Rangel, and I'm a physical therapist in San Antonio, Texas. Let's go ahead and dive into the topic. First off, let's clear up the confusion. Subacromial pain is irritation or overload of the structure sitting right underneath the acromion. That's like the bony roof of your shoulder, right? You've probably heard the term shoulder impingement. Well, that's just a fancy term for a pinch. Truth is, some amount of impingement is normal during any type of overhead movements. The problem isn't really like the contact itself. It's when that contact becomes symptomatic or painful, right? It causes some inflammation, some irritation. It can lead to things like weakness or loss of performance just because it's painful. Think of it this way. Like when you walk, you can walk on your feet and your toes with every step. It doesn't really bother you, but imagine you stub your toe. Like what happens after that? Literally every single step you take is slightly uncomfortable or more uncomfortable, depending on how bad you stubbed it. That's exactly what's happening in your shoulder. Whenever you start to irritate it, it's not until it becomes irritated that you actually notice that something is bothering you. This can involve things like the rotator cuff, the bursa, or other soft tissue structures that are around the shoulder. So then the big question is, what causes subacromial pain in baseball players? It's almost always too much stress for what the tissue can handle in that specific moment. That could mean things like your overhead volume is too high. Maybe you're throwing too much. Maybe in the weight room, you're doing too many overhead lifts. Maybe you have poor rotator cuff strength, poor scapular control. If your muscles are weak, then yeah, they're not going to be able to tolerate load. Their capacity is low. Maybe the poor scapula control, it's whenever your arm moves, right, your scapula can't upwardly rotate enough. And so then you're getting that constant pinch. And once it's irritated, it keeps pinching. Pain just kind of stays. Maybe you have bad recovery habits between games. If you're not giving your body a chance, not giving your nerves a chance, not giving your muscles a chance to recover, then you're overloading your tissues. It's giving you this smoke or pain signal saying, hey, slow down. I'm irritated. Like I need you to relax for a minute. Or maybe you have mechanical issues like your shoulder flexion is bad. You can't get your arm over your head. It's one of the first things I look at. We call it like the barometer of the shoulder, right? If you can't get your arm over your head, then there's probably something going on. Your muscles are super stiff. Probably need to work on fixing that. One of the very first things. Or maybe it's a mechanical thing where you're rotating early, your arm's lagging, and it's not on plane. And then every time that it lags, it's painful. All you do is you fix the timing of your throws and then your shoulder pain goes away. It's really, really random. But also younger throwers whose bodies are still developing are at a higher risk if they're playing year round without a real off season. So you got to make sure that you're taking the time and you're recovering well. Like the younger ones, if they're throwing more than 8 months out of the year, over 100 innings per season, the risk for injury just continues to climb. Really, the research is showing that kiddos are just specializing way too early and they're throwing way too much. So in the clinic, how do we figure out what's going on? First, we need to stop labeling every single shoulder issue as just impingement. Provocative tests like Neers, Hawkins-Kennedy, and a relocation test can tell us where you're feeling the pain. It can be on the front, it can be on the back, but they don't really tell us why the pain is happening. That's why a good evaluation is going to focus on how does your shoulder move, not just does it move or not. It's also going to look at how does your scapula and thoracic spine move while your arm is moving. We have something called scapulohumeral rhythm where all of that needs to move together. Right? It's a perfectly symmetrical rhythm that allows you to sustain the movement. But the minute or the second that you make that a lot faster, if there's any slight changes in the way that you're moving together in a slow fashion, imagine how much more altered that's going to be whenever you increase the speed. Also, your strengthened key muscles like your rotator cuff, your serratus anterior, and your middle and lower traps, If your muscles are weak, the capacity is going to be low. Of course, we can do things like get an image, maybe like an X-ray or an MRI. I mean, yeah, it can help, but honestly, we can catch a ton of these issues with the right clinical testing alone. The image is going to tell me how long is it going to take for you to get back. It might just bump back my time frame to get you back on the mound. If it's something that I think is going to require surgery because of how painful it is, or I really think that something is just not sitting well, then of course I'm going to send somebody off to get an X-ray or an MRI, because I don't have X-ray vision, I don't have MRI vision, and I want to make sure that I'm not missing anything. So why does it matter for baseball players? Here's how it ties back to you. If you're losing shoulder motion, scapular stability, or rotator cuff endurance, you're not just hurting, you're risking bigger injuries down the road. A weak or unstable shoulder leads to things like velocity loss, command or control issues, and mechanical breakdowns. That's going to ultimately, down the road, lead to higher chances of like labral tears, rotator cuff tears, or even UCL stress. Whenever you pitch, if you change your mechanics, like let's say you're having shoulder pain, and you change your mechanics, and now you don't have shoulder pain, you have to be careful at that same time, because when you throw, the stress doesn't just like disappear. It's not just like poof, it's gone. You have to make sure that that stress isn't coming from your shoulder and going to your elbow. Okay, so early intervention isn't just about feeling better. It's about protecting your career. Don't wait until it becomes really bad and to try and figure out if it's time to go and see somebody. Subacromial pain is definitely manageable, but you got to catch it early. Fix the underlying issues and rebuild the strength and the motion all the right ways. In the next video, I'm going to break down exactly how a smart return to throw program should be built after a shoulder injury. Make sure you subscribe, and if you have any questions at all or need a real plan to get your arm right, text me at 210-390-6577. Let's get you mound ready.